You have a huge role in supporting the governments, both state and federal, in curbing the spread of this virus. What exactly are you doing?
We've been involved for quite a while now, and started out when we were supporting the quarantine of the crew from the Diamond Princess in Japan. We've since moved on. We're now supporting the quarantine of the crew on the Royal Princess in San Francisco. And as you mentioned, we're working to roll out the pop-up clinics that are rolling out for the respiratory clinics around Australia, a 50-bed pop-up emergency department for the ACT government, their Department of Health. And we've also developed the online infectious disease training that over 500,000 people have already completed. And they're health professionals, people from aged care centres, childcare centres and disability workers. So we've got a lot on, and some other things as well.
Yeah, you certainly do. Tell me about the screening and the pop-up clinics in particular. There's one in Sydney at Bondi. It's been identified as an area that has a cluster of outbreaks. How long do these tests take? Who is eligible? And when do you get the results?
So really that's up to the GP services. Our job is not to run those respiratory clinics. Our job is to set them up. The federal government's working very, very closely with all 31 primary healthcare networks, or PHNs, around the country. They work closely with the PHNs to ensure that the local hospital network and the local health districts work out where those clinics should be. We then work with the GP service to find out how should we establish the facility so that it doesn't interrupt the flow of their normal operation. And it will allow a very, very smooth operation and allow them to disinfect the areas and move on. The tests, for those who haven't taken it, only literally takes just a couple of minutes, and it all depends what the backlog is in the area, but it's usually anywhere for just a day to just a few days for most people to get their results.
Aspen Medical is no stranger to some pretty serious situations. I know over the years you've worked very closely with the Defence Department. I know myself when I went to Afghanistan that Aspen Medical was a part of the training there. Also in Ebola testing a couple of years ago in the Middle East and Africa. How does this compare?
Well, I think the thing that our team is really very proud and excited about is that we can bring all of those learnings that we've learned around the world and bring them back to Australia. When you mentioned Ebola, we worked for the US government, the Australian government and the British government, and we set up a number of Ebola treatment hospitals across Sierra Leone and Liberia. All of those experiences with infectious disease, with working with large groups, integrating into community, we get to bring those back to Australia and look after our own people, help our own community at what is a very dire time.
Just quickly on the Ruby Princess, we know there's a number of crew on board there who look like they're showing symptoms. Is Aspen Medical involved in the testing?
We were part of a team of Department of Health and ABF that went on board the ship. We were really looking at how they were managing their people, how they were keeping the ship clean, did they have the right medical equipment, etc. Department of Health for New South Wales are responsible for the review and then support of those people. And as you can see, I think they've done an amazing job in bringing them back as required and caring for them to get them through what is quite a dangerous time for their health.